Hi, I'm Dr. Mark Faber, and now I'll be discussing the serotonin-norepinephrine reuptake inhibitors in the treatment of depression. We first covered the SSRIs, which are often the first-line treatments of treating depression, and indeed in children and adolescents, the SSRIs are the category we typically think about. But also for older adolescents and adults, we consider the SNRIs, the serotonin-norepinephrine reuptake inhibitors. And these include, for example, Effexor, Pristiq, as well as a newer medication now among the SNRIs, which is called Fedzima. These medications may target and treat depression that does not respond to the SSRIs. With these medications, common side effects may include headache, stomach upset, a little extra energy, more than one might be used to, and sometimes there are difficulties with sleep. And among the SNRIs, as well as the SSRIs, there may be some what we term sexual side effects. Now, in terms of one side effect that is often unique to the SNRIs, this may be a risk of increased blood pressure. And while the risk is generally felt to be low in the 3 to 5% risk category, nonetheless, with these medications, it's important to monitor blood pressure on a regular basis. So these medications not only enhance serotonin in the brain, but norepinephrine as well. These medications, generally speaking, should be started at a very low dose and adjusted upward carefully and monitored closely. Because they may not have as long a duration as, for example, one of the SSRIs, Prozac, we need to be as careful as possible to be certain that the individual takes the medication on a daily basis and doesn't forget to take the medication, or there might be some what we call discontinuation symptoms, almost flu-like symptoms, feeling uncomfortable. These medications, the SNRIs, also have a very, very low risk, as we said about antidepressants in general, of the potential for negative thinking, I don't want to live type thinking. And so this is something that we would monitor over time, and generally speaking, this is a concern up to age 24. And so this represents the second group of antidepressants, often considered if the first group, the SSRIs, are not fully effective. Thank you.